Namaste from the United States of America. I am Dr. Adam J. Pyecha. It's an honor and a privilege to be a part of the 4th International Conference on Addiction and Psychology. This research presentation will focus on the family communication patterns of both the family members affected by their loved ones that need care. They are the addict or alcoholic, and the addict or alcoholic, which we'll refer to them as the LNC, the loved ones that need care, and then the family members that are affected by the LNC. This study also measured the effectiveness of family recovery support groups using coping and resilience scales. There are over 100 million family members that are negatively impacted by their loved one's alcoholism and addiction. And families can be impacted for generations. I was born into a family obliterated by addiction. My entire immediate family, my mother Jamie, my father Wayne, both of my siblings, Heather and Scotty, first cousins, Brandy Michelle, David Matthew, my Uncle Gary, my Uncle Billy, young childhood friends, Shiloh and Daniel, have all died as a direct result of alcoholism and addiction. Al-Anon's 2021 World Service Membership Survey reported that 70% of its members had experienced significant trauma. 33% of them scored 4 or higher on Felides Adverse Childhood Experiences scale. That's double the national average here in the United States. Research indicates that family recovery support groups like Al-Anon can motivate loved ones to actually seek treatment and even maintain long-term recovery. However, only 2% of LNCs will ever achieve 5 continuous years of recovery. Notably, that existing literature primarily focuses on the LNC, often neglecting the experiences of the family member. In 1997, Alan Leshner, who at the time was the director of the U.S. National Institute on Drug Abuse, asserted that addiction is a brain disease. And this research is built upon support that the entire family system is negatively impacted because the entire family is suffering from a disease. And that's primarily Jelinek's disease concept. Prior to Jelinek, Scottish physician Thomas Trotter's 1804 Essay on Drunkenness and Declaration of Independence signee Benjamin Rush's 1819 An Inquiry into the Effects of Ardent Spirits both theorized the concept of a disease of the mind. So let's look at this approach for my research, which was a mixed methods concurrent embedded research approach, and the primary focus was on the quantitative data. Both qualitative and quantitative data were collected simultaneously. However, the quantitative method served as the foundation, whereas the qualitative research just supported it. Participants completed a 10 to 15 minute Qualtrics digital survey. It included demographic and open-ended questions, as well as 3 measurable scales. Once the data was collected, it was exported to Excel and Word before then being analyzed in SPSS and in vivo. All statistical texts met the standard assumptions and appropriate for the levels of measurement, normality, and etc. The effectiveness of FSG, family support groups, was measured with the 13-item coping scale from Hamby et al. 2013 and a 10-item resilience scale, Connor and Davidson 2003. I also utilized the Kohner and Fitzpatrick's 2002 Revised Family Communication Patterns Instrument, which was used to analyze the relationships between these variables, incorporating dimensions of a family communication as a moderating factor. The Revised Family Communication Patterns has 2 main components. There's conversation orientation, CV, and conformity orientation, CF. So CV, conversation, measures the openness among family members, and it encourages the sharing of thoughts and feelings. High CV families promote independence and idea exchange, while low CV families may dismiss feelings. Conformity orientation, or CF, reflects adherence to family beliefs and values. It's focusing on hierarchy and parental authority. So higher CF families prioritize rules and harmony, whereas lower CF scores allow for more autonomy and personal growth. Let me give you a brief overview of the 4 family system types. So there's consensual family type. Think a Modern Family or Cosby Show, and they're more likely to foster this family recovery and potentially sustain long-term recovery for the LNC and the family member, the affected family member. There is a consistent balance of encouraged communication with adult-to-child social conforms, and this underscores the significant role of family dynamics in the context of substance abuse. The pluralistic family type, this is higher CV, lower CF, encourages open conversations and child independence, but there can be minimal parental control, as seen in TV shows like The Middle or That 70s Show. And families may still struggle with poor communication and unintentionally enable the LNC to use, leading to disappointment when the LNC refuses or even if the LNC relapses. And this often creates dysfunctional roles among family members. So highlighting the need for balanced dynamics when dealing with substance abuse, it should be known that the Addams family actually falls on the line of pluralistic and consensual. Plural consensual is when CF levels are closer to the consensual family level. Protective family types. So you have The Sopranos or The Bernie Mac Show, and we have low conversation, high conformity, and this often exhibits an authoritarian parent-child relationship focused on obedience. The environment can increase the risk of relapse, especially in individuals with low need for conformity. Acceptance and forgiveness in protective families can vary, and rebellion, like in other family types, may also occur. And we have our laissez-faire family, which these family types have low CB and low CF, and they're characterized by lacking communication and conformity norms. Haverfield notes that LNCs may neglect responsibilities and become abusive. Shows like Married with Children, Shameless, The Simpsons, even The Family Guy can portray a similar communication pattern among the family unit. My sample, 18 years of age or older, it was done over 10 weeks. Recruitment utilized purposive and convenient sampling. There were 282 surveys opened. 44 were dismissed because they were incomplete. 57 participants were excluded because they reported that they had not been affected by an LNC. And so this left 181 surveys to analyze. So we had 181 participants. 94 participants, as you can see here, were the P group. So they were actively participating in family recovery support groups. 87 were not actively participating in family support groups. So out of all the participants, and even some of those that weren't actively participating, they had done previous work with family recovery support groups in their past. And so 54% of the participants that were active or had been active in some type of 12-step fellowship within their life. And then 30% had done some type of counseling, whether it be individual family counseling, and some of them would even go to like the treatment center where their loved one was at and receive some type of family counseling. Let's take a look at the demographics. The gender was definitely consistent with the literature. You know, mostly female, majority female, 155 females. There was 23 males and 3 non-binary. Needs to be noted that 65% of the males in this study were in the N group, the non-participation of family support groups. And if we go ahead and look at age, which I decided to go with generation cohorts, 96.4% of Generation Z participants were in the N group, not recovering. Looking at the baby boomer group, we see that 46 of the 62 participants were actually participating in a family support group. Again, this is very consistent with the literature, but it shows us too that young men are not likely to recover. And we go on to ethnicity, consistent with the literature. This study was predominantly white, and it represented mostly to be in the P group. Whites were more likely to be participating in family recovery support groups. And this is quite concerning, especially when 12 of the 14 black participants, 86%, were not participating in FSG. So they're affected by an LNC, but they're not participating. So let me reiterate, young minority males, specifically blacks, report being affected by an LNC, but are less likely to be active in a family recovery support group or family recovery-based program. The research aimed to examine the effects of family-based recovery support groups on coping and resilience in individuals affected by a loved one's alcoholism and addiction. It also investigated family communication styles, and this was between the two subgroups, P and N. So there were mean differences between subgroups for both CV and CF. We can take a look here. You see that the P group, their mean was far more likely to be from a CV family, and then the conformity group, those groups that were from conformity families, were more likely to not be recovering. And while the mean differences are, it's 2.93 in the CV group and 2.4 in the CF group, they don't mean much, but as the study progressed, we start to see that there are trends. And so let's take a look here at coping and resilience for the subgroups. And so coping for the P group, those that were active in FSGs, had a 2.14 mean higher than those that weren't recovering. And resilience was the same way. Resilience mean scores in the P group was 28.44. That's 2.23 higher when compared to the N group of 26.21. Pluralistic family types were more likely to participate in FSGs. However, protective family types were far less likely to participate. A one-way ANOVA and a post-hoc test found strong correlations between resilience, specifically, and family type. In fact, protective family type scored far lower in resilience scores, like mean differences of negative 3.93 than participants from pluralistic, and negative 4.88 from participants in consensual families. Open-ended questions were embedded in the study and asked participants to reflect and share about their LNC's behaviors and how to manage stress and what to do, how to turn negatives into positives. Altogether, the responses amounted to over 42 pages of single-space text. After reviewing the data multiple times, I began some open coding based on my own reflections. I then uploaded the transcripts to NVivo for some automated coding, and then refined the results by comparing them with my initial codes. And qualitative questions such as how do you turn negatives into positives and how do you cope with stressors were used to investigate the relationships between coping resilience, the family communication styles, and also family recovery support groups across both of the subgroups. So there was a generalization query to find an overall concept for all of the 42 pages of data, every shared response. And as you can see, death was referenced 1,209 times, not the specific word death. However, this hopelessness, this overdose, the concept of dying was the underlying tone of the shared experience of the family members. An exact word reference query specific to how participants cope and manage stress related to the LNC looked like the following. So, support help system seemed to funnel into two specific groups. The first was support help system went into group meetings, programs, and then friends. And then support help systems seemed to inform into tough love, experience, learning, and boundaries. And this is very, very consistent with family recovery-based programs. So matrix coding established an overall thematic metaphor, coping and resilience when our loved ones die from addiction. And the main themes identified included learning to build protective boundaries, building protective boundaries, exploring new ways to love, creating new ways to love, and consulting and collaborating with informed systems. 75% mostly from the P group, answered yes, that family recovery support groups or family-based programs were beneficial. 42 participants answered no, FSGs were not beneficial, and 65 participants responded they didn't know or preferred not to answer. Some of the reasons why were not enough time, they were angry with their loved one, it was too religion-based. Here's one reflection a participant shared. I wish I had joined a support group to help me with coping strategies. I was not in the city with my sibling, but I was hearing about everything that I had witnessed on my own. I didn't want to burden my mother even further with my fears, concerns, so I struggled on my own. Now, this next reflection really has stayed with me. It's like watching your child who cannot swim drown right in front of you. You're watching them die even though they're already dead. I've buried a child, and dealing with another child's addiction, it's heartbreaking, and my meaning in life is hopeless. The significance of this study illustrates the positive impact that family recovery support groups have on participants, confirming their crucial role in the recovery journey. The group mean scores of CP and RS are both 2 points higher in the P group versus the N group. These small differences become far significant after the independent T samples, correlation coefficient, and one-way ANOVA test, all of which are indicative of the literature that, yes, family recovery support groups can help the perception of the family member that's affected by their LNC. Qualitative themes, we just saw building protective boundaries, creating new ways to love, and collaborating and working with informed support systems are practical, and the theoretic prevention should be implemented in treatment and counseling centers, especially for those family members whose LNC has died. Research demonstrates that individuals from pluralistic families are significantly more likely to engage in family recovery support groups. Stark contrast, protective families show a marked reluctance to participate in these groups. This evidence highlights the need and the crucial role of family communication styles in shaping participation in recovery support group systems. And so bringing it together, perception of SFG was complementary to coping and resilience. Participants who felt that FSGs were beneficial had slightly higher CP scores and RC scores. Of course, there were outliers, but this shared experience were all very similar. There's pain, there's suffering, this yearning for themselves and their LNC to change. But across the board, FSGs were the centerpiece of this research, and it's not the only way to cope and manage with the adverse effects of the family disease of addiction. Exploring the demographics may yield complementary findings. So participants from protective families scored lower in resilience scores. Almost 4 was the mean than the participants in pluralistic, and almost 5, 4.88, lower than participants in consensual families. So upscaling prevention frameworks so that prevention professionals have insight about the family communication patterns is going to be helpful for clients and the family members. 39 of 181 participants had been affected by 3 or more LNCs, and if we look, it's who? The pluralistic and protective families. So conformity plays a big role here in recovery. And so, Felidi's study on average childhood experience would suggest that these families probably have an increased risk of passing on genetic predisposition to addiction. And the intake process for substance abuse counselors during treatment intake should be upscaled to include family communication patterns. You see here, protective families were far more likely less to seek treatment. This was the LNC that said no, they wouldn't go to treatment. That's what their family members had reported. It's also important to note how prevention literature around coping and resilience can build upon the younger generations of men, specifically minority men. There were some limitations. Social science research and human subjects are complex, so social desirability, the lack of gender and ethnicity. Was the survey too long, 10 to 15 minutes? And utilizing 3 measurable scales is a lot. If I were to do this again, if I were to replicate this study, well, I wouldn't replicate it. I would enhance it by not doing convenient sampling. I would only do purpose of sampling. And for the future, families recovering from alcoholism and addiction, FRAA is an open Facebook group. There's currently 262 members. We have the LNCs, prevention professionals, prevention organizations. There's even a board of directors, and we're piloting a study right now with certified substance abuse counselors utilizing the Pyecha and SOHA adapted family communication patterns instrument during client intake. And so the goal is to gather feedback on whether this understanding can improve counselor and client connectivity and hopefully inspire change in treatment plans for clients from protective and laissez-faire family types. And also, along with the FRAA organization, we have the FRAA Recovery Podcast, and it's produced over 50 episodes. It's garnered more than 2,700 downloads worldwide, and not just America, but Germany and India and Canada and Japan and Hong Kong, Brazil, Denmark, and Russia, and it aims to transform attitudes and perceptions and knowledge about addiction. So interventions, especially a FRAA intervention, can strengthen positive relationships among the family members. Intervention is especially beneficial when a loved one begins treatment. So family members from protective and laissez-faire types may be more willing to participate if clients know what their family type is and we're able to adapt the treatment plan around that. So in conclusion, while prevention and addiction experts continue to play a critical role in saving the lives of LNCs suffering from alcoholism and addiction, the percentages remain grim, and the hundreds of millions of affected family members are left confused, angry, and in grief. This research, families recovering from alcoholism and addiction, serve to boost the effectiveness of existing family recovery prevention programs. Implementing the FRAA adapted family communication patterns into the addiction and psychology field should become a non-negotiable. I want to thank you all so much for your time today. Please do not hesitate to contact me if you have any questions or would like to learn more about FRAA. I love the research. I love to collaborate. We need to work together, and hopefully we can find a way.